was kind of like the pioneer in the field, right? He did it for Tiger Woods, A-Rod, like all those big people, and he kind of started doing it for sports injuries. And then obviously people started using it for cosmetics and so many other applications.
Now we have something that we're really excited about. And so we wanted to welcome back Dr. Adeel Khan. He is our regenerative medicine expert that ultimately, if you guys have remembered from the previous podcast, he's the founder of Eterna Health and really offers some unique perspectives on regenerative therapies, gene editing therapies, and latest and greatest in cutting edge technology. So Dr. Khan, listen, Adeel, it's great to see you.
Welcome back.
I do have a lot of new fun facts to share.
Love that. I mean, look, you're a jet setter. I mean, you're starting Eterna basically all over the globe. You spent the summers in Japan. You were recently with us in Mexico and now heading to Dubai to, build your own palace there, complete with lab. And, it's all exciting stuff. Maybe what we'll do is this. I wanted to kind of, dive into your expertise, kind of give everyone who hasn't listened to or seen the previous episode to kind of take us on the journey that brought you here. And then we'll kind of dive into some of the latest and greatest that you offer.
Yeah, no. So I think it was really wanting to help patients who weren't helped by the traditional medical system. And now more than ever, I see why regenerative medicine is becoming such a hot topic, because people are looking for alternative solutions. And regenerative medicine not only offers solutions to chronic diseases, but I think it also offers great solutions for longevity, for people who want to live healthier, better lives, who just want to look better too. Because at the end of the day, why does our skin age? It ages for the same reasons the rest of our body ages, which is the mitochondria, the chronic inflammation, the oxidative stress, the repair mechanisms not being there. So now that we understand that the underlying dysfunction is similar throughout the body, we can target and repair that. It's exciting because regenerative medicine's kind of had all this hype and hope for like 2 decades, but now it's finally actually in this era where it's translating into real world results and where we can engineer and standardize our products.
You're right. There is such a buzz for it that, you can go to multiple other countries and on every street corner, you're going to find somewhere where you can get stem cells and exosomes. Maybe talk about how you truly became a leader in the field, and then how essentially the way you practice is going to be different than just, I'm heading to Panama and I'm going to get some stem cells. Kind of tell me your philosophy.
Yeah, it was really just wanting to improve patient outcomes, which drove me to continuously innovating. So I wasn't satisfied with the results I was getting with traditional, let's say, umbilical cord stem cells, or, the whole journey really, right? Like, because I started out doing PRP, platelet-rich plasma, which most people are familiar with Dr. Anthony Gallia, who's kind of like the pioneer in the field, right? He did it for Tiger Woods, A-Rod, like all those big people, and he kind of started doing it for sports injuries. And then obviously people started using it for cosmetics and so many other applications. And so I obviously use PRP a lot in my practice, but I saw its limitations, in especially for chronic degenerative conditions. And, for cosmetics, it was kind of like, it's okay, And so exosomes was kind of the next one. And then exosomes also, not bad results, but exosomes only stay in your body for minutes to hours. They're kind of like the soup that the stem cells grow in, So they have all the signaling molecules, but they're taken up pretty quickly, meaning that they often need repeat dosing or frequent dosing to really get good results. And then obviously there's all these stem cells out there in the US and other parts of the world. And stem cell is such a broad term that it almost doesn't mean anything. And that's a problem. And so when they start using stem cells for everything, that's when you get suspicious that, hey, is this a real thing or not? And it is, but there's a lot of nuance to it, because if you're taking your own fat or your own bone marrow, and that, which is what people do in the US, and they call that a stem cell, it's not really a stem cell. It's more of a signaling cell, or the correct term would be a progenitor cell, meaning it can differentiate into certain types of cells, but for the most part, they're just anti-inflammatory signals, which can still be helpful, but it's just a misnomer. And then it confuses patients, because patients go to, like, I got stem cells done. It's like, no, you didn't really get stem cells. You just got something that reduces inflammation. And it confuses people because if you actually want to do stem cells, you have to isolate them, you have to culture expand them, which as of now is still not FDA approved and therefore not allowed in the US outside of clinical trials. And so you have to be careful where you go. And if you go to a lot of these unregulated or less regulated jurisdictions, then it's kind of almost a free-for-all, because now it's like the other extreme. Now you have less regulation and you have this opportunity to do stem cells, but how do you know where you're going is actually legitimate? And my biggest piece of advice is, because regenerative medicine is still a new science, I would recommend only going to places where they're actively involved in research. And I think that's the big takeaway for me is I have aligned myself with other practitioners who are trying to do R&D and who are trying to push the field forward, while at the same time trying to help patients in the real world. And that's what's allowed me to innovate. And now we can really get to this next era where we can select using cell sorting technology, and we can select the best type of stem cell within a subpopulation of those stem cells. And these are called the mu cells, which I'm sure we'll go into. But basically, these cells can survive. So they don't die when they go in your body, which is the biggest problem with umbilical cord stem cells. They've shown this in, if you do intravenous stem cells, most of them get trapped in the lungs. A lot of them die. And even then, you still get some patients who get decent results, as we've all heard about. But the consistency and reliability of results is just not there.
Listen, that part is unfortunate, but the great part is that there are so many studies that are currently underway that are kind of proving what, we've thought all along, that there are potential benefits and that you can, halt the progression of aging and at least supply the body with some of the basics. You essentially, as we said, your Eterna is going all over the world. You recently opened a clinic in Canada. You are moving to Dubai. And the interesting part is that recently we had the opportunity to collaborate together. Proactive Longevity, as you know, is our clinic in Cabo, and we had the fortune of having you there. And what was your initial thought process? When we said, all right, we had originally met, I remember the entire conversation, and it was, basically how we could bring two worlds together. What was your initial thought process? We said, all right, listen, I think this would be a good collaboration with Proactive Longevity.
Well, I love learning. So for me, obviously the interesting part was you guys being plastic surgeons. I think there's so many interesting applications for cosmetics and tissue regeneration in the cosmetic applications. And that's where I think these cells, when combined with scaffolds, for example, I think there's going to be a lot of interesting applications for like facial rejuvenation and even for body parts as this technology becomes better. For example, I'm talking with this company right now where we're going to do a clinical trial together. They're called Cytex Ortho out of St. Louis, WashU, and where's the University of Washington? Which one's the one in St. Louis?
WashU. Yeah, WashU.
Yeah. WashU, okay, yeah, I was getting confused, yeah. And so they have this really cool technology where they can do 3D bioprinting of customized scaffolds. So they can actually take a CT and MR, and then they can use that to create a customized scaffold for the joint. And then you can see that, like with the mu stem cells, that's what we're going to do with them. And then you can actually resurface an entire joint, in theory. They've already done this successfully in animals. But then think about it for cosmetics. You could make a customized scaffold for like a facial reconstruction for an area where you have like a defect or you have some muscle atrophy, which happens to people as they age. So I think for me, the applications in plastics is super interesting. As someone who was also interested in plastics when I was a young lad, because when I was in medical school, I had done all my electives in plastic surgery. So I've always found that field very interesting. So it's cool. It's cool to work with some top surgeons and just think about and start really, I think, moving to this era where we're not putting synthetic products into people's bodies anymore, and we're really trying to reconstruct tissue. I think that's kind of the holy grail of plastic surgery too.
Yeah, we've talked about it forever. The interesting part is, Dr. Dana Porpay does a lot of breast surgery, and we've talked about the complications associated with implants. And when you look at, how the percent that you have to remove and replace, and the percent that the shell itself, has a leak, or all these types of issues, the capsular contracture and so on and so forth. And we had talked about before, going along the lines of that scaffolding is creating a custom implant that has that biological frame. And then you seed it with stem cells, allow the body to grow into it. And now imagine, again, when you think of the applications, obviously the more important ones are going to be true tissue, organoid regeneration, things like that, right? But it essentially shows us an avenue where we can use this for some of the current things that cause potential issues. We're not saving lives with these, but again, I agree with you as far as the joint replacements, and these are all parts of it, but you just take it one step further, and you're right, facial type of augmentation, breast augmentation. We've had so many complications with, you've heard of the Brazilian butt lift, where we do lipo and fat transfer. I mean, it's been the procedure that has the highest amount of deaths because people were injecting fat into the arteries and people and veins, and people would have, all kinds of issues, right? And so we're just looking at ways to avoid complication. That's it.
I think people don't realize, including most doctors, that regenerative medicine is going to disrupt all medical specialties, not just orthopedics. And that's the interesting thing about this field, because ultimately it's being used, and even we're using it, for autoimmune conditions, type 2 diabetes, eventually type 1 diabetes. There's trials it's the whole gamut of this chronic illness. And so the whole medical system's in for a change, and it's going to be really interesting how these cellular technologies replace the old ways of doing things. And because the institutions that be, they're always going to try to slow down this change, because obviously they're designed in a way to support the current system, which isn't really working anyway. So I think people are going to be more open to this stuff just because they kind of know what's happening right now isn't really optimal.
Yeah. Going along these lines, when you moved to Dubai and you're opening this clinic, is there a particular, is it going to be just the same thing where you are doing general regenerative medicine therapies, or is there a portion of that practice that will be treating specific diseases, as far as, neural disorders? Are you treating cancers? Are you doing things like this, or is it not there yet?
Yeah, well, I'm trying my best to stay within my scope, let's say, but it's almost tricky because it's okay, my scope is, let's say, sports medicine or orthopedics, right? And interventional pain. So I'm trying to stay in that lane, but for example, we do cosmetics, and it's not like I wanted to necessarily do cosmetics, but people kept asking, and the results were quite good. So it was okay, let's start doing cosmetics. And then it's kind of the same thing with these autoimmune conditions. I'm not a rheumatologist, but at the same time, these intravenous infusions and peptides and bioregulators work really well for rheumatoid arthritis and lupus and all these other autoimmune conditions. So I am trying to get other specialists. So we do have a urologist, we have a pediatrician, we have a neurointerventional radiologist. And so I'm trying to get other specialists on our team to kind of manage these other conditions. And we do have, for example, cancer specialists who specialize in this. And so they'll work with our patients specifically. And that way they're getting someone who's kind of specialized in using, let's say, regenerative medicine or cellular therapies to treat that specific problem. But yeah, to answer your question, we can treat many of these chronic diseases. We're still, I would say, let's say, a little bit hesitant to tell the world about it, because there's obviously a lot of controversy when you start saying you can treat these conditions. And obviously, I think for now, it's going to be a slow process where, as we accumulate more evidence, both in the real world and controlled trials, then I think it'll be easier to probably promote it more,
Yeah, you and I talked about this before in the past, especially with the collab between Eterna and Proactive Longevity. We talked about potentially coming up with certain standards on pre and post treatment, where we could actually extrapolate the data, right? We could take this and say, all right, if we look at 10 different biomarkers or more, and look at, someone who's getting a full body scan and, evaluating the heart and things like that, and then looking at it afterwards to see, what has changed.
We've at least implemented something called biological noise, which is the measurement of errors in gene expression over time. So as your genes the root of aging is called genotoxicity, which is basically means accumulation of DNA damage. So you accumulate oxidative stress, you accumulate this damage on your DNA, and then your DNA, as your cell reads the DNA, it makes more errors because obviously there's damage on those and on that DNA that it's reading. And so there's this variance over time that increases. It's called biological noise. And there's a company that can measure that. And it's based off, like 2 decades of research. And it's very valid for measuring speed of cellular aging and accumulation of damage. So you can actually measure objectively. And it does 19 different organ systems. So basically you can measure before, okay, I did the IV stem cells and now I did them 6 months, and now I'm doing this 6 months later. How much did I slow down the speed of aging in my body, cellular aging? And now you have some objective evidence as opposed to just saying, yeah, I kind of feel better.
When we talk about the, mu cells, so let's say the best of the best, the cream of the crop, how often do you recommend that individuals undergo these types of therapies? So let's say joint injections aside and facials and microneedling and things like that with these cellular products, but let's say intravenously, what are your current recommendations? So, as you know, the homeowners at Diamante, where Proactive Longevity is located, they come down for a particular season. Is it great for them to get it done when they arrive and when they leave? So if that's a 6-month window, or do you recommend more or less?
I wish we had a clear answer on this. We will hopefully have a clear answer in the next year or two once we get more data from that tracking. But based off the trials that have been done and other groups doing these things, there is some variation. And I'd say it's for 2 reasons. One is probably some people are going based off the mechanistic science, which means that the stem cells, we know that the mu cells, for example, stay in the body for about 3 to 4 months. Some of them will integrate into your body, but a lot of them will be cleared out by your immune system eventually. So you could make an argument that you should do it every 4 months as a way to really stay on top of it. So you could do it 3 times a year. But on the other hand, we know that these stem cells send signals to your own immune cells. And they also do something called mitophagy and mitochondrial DNA transfer, which is super interesting. They actually transfer mitochondrial DNA to your cells. And it's like giving your cells new car batteries, It's like giving them the ability to work better and more efficiently because the mitochondria DNA accumulates damage as well. And if you're able to replace that, then obviously you have more efficient cellular metabolism and less oxidative stress. So if you go by the rationale there, where it's like there's these downstream effects, how long do those downstream effects last in the body? It seems like it can last in a lot of patients for 1 to 2 years, just based off how they feel subjectively, meaning they actually feel younger, they feel more vibrant, and that effect can last for 1 to 2 years. So that's why I don't necessarily recommend every 4 months for patients unless they really, let's say they really have the means to do that. And
unless you're Brian Johnson and
Yeah, exactly. Yeah, exactly. There are people who basically don't have a budget necessarily, and they just want to do what's going to be the most, let's say, maximum that they can do. So I think there is a patient base for that. But let's say for most people, I think once a year is a good frequency where they'll have a pretty good effect, and it should last at least that long.
When you talk about the mitochondrial DNA transfer, is it something that could be concerning? Let's say you got, the wrong portion of DNA.
So Professor Dazawa, who's the one who discovered mu cells in Japan, so she's done studies looking at how these cells integrate into hosts, like into obviously into animals and into humans when you do the infusions. And it doesn't, the cells function completely fine. There's no issues in terms of like causing, cancer or causing dysfunction of the cells. And the beauty is they actually make your body healthier if you think about it, because you're giving your cells this new DNA that can integrate almost seamlessly, and it can then decrease inflammation, it can decrease oxidative stress, which if you think about it, those are the 2 of the biggest drivers as to why our body ages and breaks down in the first place. If you go back to a first principles perspective, if you think about the microenvironment where disease occurs, a lot of that has to do with your cell's capacity to deal with the byproducts of cellular metabolism, because cellular metabolism is kind of like a power plant, right? You're producing this waste products every time your cell cycle goes through this. And these waste products, over time, your cells can't handle it anymore. And then that's what causes the damage to accumulate. So you're just giving your cells more ability or resiliency to deal with those byproducts. And hence why de-aging your body and slowing down aging. And if you slow down aging, logically, you're slowing down every chronic disease, right? Because most chronic diseases are age-related. So it's a pretty easy justification for patients to understand, oh, okay, that makes total sense. Because a lot of people are concerned, obviously, understandably, putting foreign cells in your body. But once you understand what they're doing mechanistically and how they work, it puts a lot of people at ease.
I know you've treated, tons of celebrities. You've done athletes, but also regular civilian population as well. Are there any particular success stories that stand out to you?
Yeah, I mean, the ones that stand out to me are definitely the long COVID cases and like the chronic severe pain patients where they're pretty much on disability. And I think those ones really are meaningful because those patients are able to go back from just basically not functioning to like a normal life, which is obviously profoundly life-changing for them. And especially for the ones who in long COVID, I mean, my patients, they've gone to Johns Hopkins, they've gone to Mayo Clinic, they've gone to all these top institutions, and they have really not much to offer them besides there's like fluvoxamine or something like an antidepressant, which doesn't really do much for long COVID. And essentially they're left to just figure it out on their own. And so it's really rewarding to help those patients and get them back to a normal life. And it also shows the power of these treatments in treating the underlying cellular dysfunction. And I'd say when you can treat those, chronic complex diseases, then treating someone who's healthy, just looking to rejuvenate their body becomes a lot easier too.
You brought up long COVID, and something that's has been used a lot recently has been therapeutic plasma exchange for long COVID. What are your thoughts about therapeutic plasma exchange for that? And also, what are your thoughts about doing therapeutic plasma exchange in order to kind of tee yourself up for stem cell therapy?
Yeah, I think for both of those things, it's a great thing. TPE, as is the short name, they've also done studies in terms of looking at it for like longevity and slowing down aging. And again, if you're slowing down the DNA methylation, the accumulation of damage, you're reversing some of that, you're reducing oxidative stress. So you're preparing the cells for the new cells, right? And so the new cells, the environment that you put them in dictates their ability to do their job. So if you put them into, let's say, the Bronx, where it's the ghetto, and they're not going to do a great job surviving, but if you put them into like Beverly Hills, they're going to have a much better chance of surviving and do what they need to, right? Which is to fix the houses, to fix the damage. So they can't, it's really hard for them to do that when you put them in an environment where they can't thrive. So TPE is just one way to prepare your body for that. And I think for long COVID, it's the same principle, which is you're removing some of that toxic burden, but you're also helping the cells to fight these chronic infections that your body is dealing with. It's the same principle, which is you're giving the body its own ability to heal itself.
And I had the pleasure of watching you do some of your magic, a couple weeks ago. And I have to tell you, I think what sets you apart from a lot of people is you are a master technician. And I saw it with your stellate ganglion blocks. And I thought it was not only seamless the way you did it and so comfortable by putting a needle right by the carotid artery and like no one's business. But at the same time, from what you've said to me and all the stories I heard from others that were there, it's been just an incredible treatment for people for PTSD and for other, behavioral type of problems. I have a question for you. Do you think something like this would work for addiction? People that
Actually, I have had patients with alcohol addiction and let's say other drug addictions, and this was dramatically helpful because if you think about it, why do a lot of people turn to addiction? It's because of unresolved trauma, emotional trauma, and they use the addiction, whatever that may be, even food addiction, right? In the case of obesity, people are using that as a coping mechanism to deal with the trauma that they never resolved. And this is just a way for them to shield themselves from dealing with that. So it becomes for a lot of them, this is their crutch, so to speak. And I think when you break that cycle in their nervous system, it can help them to modify their behavior easier, or it can prime their body to be more receptive to something like ketamine or psilocybin assisted therapy or something like that.
Great. I have someone for you. I'll send them over.
Yeah. The interesting part, I agree with you. I think putting different specialties together when it comes to using some of these regenerative therapies, it only makes sense because, each one brings their own collaborative effort to the table. And I think that's where it just made for a good partnership. when are we going to see you back at Proactive Longevity?
Well, as you know, I'm going to be on the other side of the world, so we'll see. But obviously, I think there's word is spreading, as you guys know, amongst the community. That's Hollywood, and also amongst a lot of the high net worth, because a lot of people are looking for alternatives now to even fillers, let's say, and even Botox. Like, it's still obviously there, and you can even do Botox with the stem cells, but it's just a lot of people are looking for alternatives and they want to do things that are natural, right? And I think this is as natural as it gets. So it's only going to become more popular, and hence why we'll be there. I mean, we have, even if I'm not there, we'll have, our team there or other doctors and whatnot.
Awesome. Adeel, I have one last question for you. And this is something that, somebody doesn't know anything about stem cells, comes into your office and says, I feel great, but I have all the money in the world and I just want to live longer and I want to live better. So ideally, you come up with a list of things, and one of them being IV Muse cells, right? And the person turns around and says, what are these Muse cells? Where do you get them from? Who gives them to you? Am I not going to have a reaction to them? And again, I know a lot of these answers, but for that person who doesn't, how do you explain to them where this cell comes from?
Yeah, the donor selection is actually very important, which is a good thing to highlight, because the inherent Muse cell concentration in most live births is actually very low. So over 90% of the samples we collect are thrown out because they don't have enough Muse cells in them to begin with. Because a patient has to be very healthy, and they probably have to have some sort of genetic superiority for them to just have a high Muse cell count inside of their umbilical cord tissue. So that right away helps to keep the donor population more homogeneous, because there's a lot of what's called heterogeneity, which just means variability when donors give their umbilical cord tissue. So if you go to, and we were doing that too, obviously up to like a year ago, and most clinics still do that, which is that you're taking, the donor that you have, but you're not standardizing the cell population. So for us, because we have to standardize the cell population to minimum 70% Muse cells, they have to have an X amount to begin with. And that already creates a selection bias of a very few healthy individuals. And so they're also unvaccinated, which to us is important. That's obviously a controversial topic, but I think, there is enough evidence to suggest that the spike proteins can cross the placenta. And so for us, we just don't want to take that risk. And then we also test, in addition to the standard infectious disease testing that everyone does, we also do EBV, CMV, and Lyme. And it's a GMP factory, and it is EMA approved, which means European Medical Agency, which is like the equivalent of FDA in Europe. So we do have a lot of kind of checks and balances to ensure it's good quality product. And then when we ship it and import it in, we have a third party, the university locally in Mexico, for example, or in Dubai, that will do cell viability testing to ensure that nothing has changed in transport. So that way we can reassure our patients, hey, we're doing everything we can to make sure you're getting the highest cell quality product. And it's also from the best donors based off the engineering and isolating of the cells.
If you like this video, you're going to love this one.
They actually don't know how to regulate cell and gene therapy, because it's not the same as drugs, right? Because you might have a high upfront cost, but you're curing a patient or you're putting them in remission.